Welcome to the Low Carb Athlete Podcast, where we focus on discussing topics to help you burn fat, optimize health, and improve performance in life and sports. Transform the whole you from the inside out with the holistic method. Let's dive in. Here's your host, Debbie Potts.
All right, I'm so excited to have Dr. Debbie Rice back on the show today to talk about a big subject, thyroid function, hormones, and our overall metabolism. So, Dr. Rice, Debbie, thanks for coming back on to dive in deep.
Thanks for having me.
You are a naturopath doctor and you work with Dutch, but you also have your own practice, correct, in Portland?
I do. I have a small part-time practice in Portland.
So Are you seeing clients in person right now? Are you doing a lot of virtual calls?
Yeah, I would say mostly telemedicine right now, but things are switching, things are changing, and insurance can a lot of times dictate what doctors are able to do. So things have been kind of on another transition. There have been lots of transitions this year. So it's kind of like keeping up with what's happening, who's doing what, how we're supposed to do things. So that's added another, level of fun to practice. Mm-hmm.
So you can't see people. Your people's insurance doesn't cover doctors if you're.
And it depends on your state. It depends on your licensure, at least for naturopathic doctors. And so, in the state of Oregon, where I am at, there were some pretty strict rules about naturopathic physicians and what they can do as far as telemedicine, phone call medicine, versus seeing somebody in person. And so there was a big shift when COVID happened, and it actually opened up a really awesome world of telemedicine for naturopaths, which has been really great because I think, when we're talking about just life in general, being able to maintain healthy lifestyle, especially when there are lots of big stressors happening, is really important because we're also looking at that as a key factor of, that foundation of health. So I think being able to allow that accessibility to those providers can be important.
Yeah, it's funny that, we are on a mission. I'm a nutritional therapy practitioner, an FDN practitioner, and you're a naturopath. That we're, I'm kind of on a mission to collaborate with similar minded people that like, how can we create impact in our world, not even just our country, about self-care, being a health optimizer, and really taking action and ownership of your health. And our listeners might be more of the athletic side of the world, but I think it's important to educate athletes that you can be fit, but not healthy. And like a lot of people can be fit and still fat, and fit and still have total gut dysfunction. And our topic today is going to be more focused on the thyroid, but that's a good transition into how low thyroid and hormones are so impacted as athletes. Like I feel like I ask you, I need to run a full thyroid panel and see where I'm at because I have a lot of the symptoms. So we'll talk about kind of the symptoms of low thyroid, and I'm sure some people have high thyroid, but it seems like low thyroid is so common. But also we'll talk, I'm sure too, that you often have HP axis dysfunction or adrenal exhaustion when you also have low thyroid, because everything is tied together. As we said, like the orchestra of our hormones is all tied together. So
absolutely,
what you want to get, kind of your main missions we want to go over and teach people today.
Yeah, I think it's important to understand that when thyroid is not functioning well, like our thyroid is our main metabolizer, right? So it is one of the main regulators of our metabolism. So what's happening with our heart rate, what's happening with digestion, what's happening with our cellular function. And when we're looking at thyroid function, if thyroid is stressed for whatever reason, disease state, stress, hereditary, like autoimmune, there are many things that can influence thyroid function, nutritional status. If you treat just the thyroid, it's like we're trying to take a closed system and influence it, but our body is not a closed system. And so if we only address the thyroid, say we just put somebody on thyroid medication, it's not addressing the full issue because your thyroid gland, your adrenal glands, your sex hormones, so your ovaries and testes, also play in all of that. They feed off of each other. Your thyroid and your adrenal glands are best friends. They work together to make sure that your body is able to handle the metabolic demand, and that you're able to work, put one foot in front of the other, or deal with whatever stressors are coming your way. And if you're only addressing the thyroid, you're doing your body a disservice by not evaluating the other components that may be influencing that thyroid function.
And we'll talk about too, I know so many clients as a personal trainer for 25 plus years.
Yeah.
Everyone always had, thyroid medications. And so if we can kind of go over proper lab testing, what functional medicine doctors will test, like a full thyroid panel versus the doctor will just measure, your TSH. And so if we can talk about that too, I think a lot of people are, given medication without really looking at the whole picture. Because I have so many clients I trained for the years as a personal trainer that they were always, you look at what medications they're taking, prescription drugs, and a lot of women, especially women, are on thyroid and Armour thyroid. And if it really, is it helping? And is it really looking at the whole picture when you're just, putting a Band-Aid on something, you're not looking at the whole reason, the why.
Right. And I think that there's also, whether you are more of a professional athlete, right, versus I don't want to say amateur athlete, but maybe amateur is okay to say. Yeah,
just exercising. People just exercise. I can't think of it either. What do you call it?
Yeah,
just to stay healthy versus someone that's a competitive athlete training for events.
Yeah. And there is a lot of manipulation that goes into athletic performance, especially if you are in competitions. And a lot of times that has to do with looking at thyroid function, hormone function, and manipulating those. And so when we look at thyroid function, they're in general, conventional doctors will look at TSH. And TSH is your thyroid stimulating hormone. This is the one that the brain gets the signaling from, right? So we look at your, the signaling from your brain to your thyroid, and there's a negative feedback loop that happens so that the thyroid can communicate with the brain of how much thyroid hormone is actually in the body. But TSH is helpful when we're looking at brain to thyroid communication, but it doesn't let us know what happens after that. Once your little thyroid gland, which is located on your neck here, it looks like a little butterfly, kind of flew right into it. Mm-hmm. It has these little wings. It has a little middle, which is called the isthmus. Your thyroid gland gets those signals from your brain. And then the brain is telling the thyroid gland, well, we need more or less thyroid hormone in the body. And in general, what we can test for and what we usually manipulate are your T4 levels and or your T3 levels. And so you have this whole conversion and kind of pathway that has to happen in order for all of this to happen. You have to have what I call, when you get the signaling to your thyroid gland, your thyroid takes your T4 and your T3, puts it on a bus, sends it through your bloodstream, right? And so when it goes through your bloodstream, it ends up stopping off at your cells. And what happens at the cellular level is you get the activation of your thyroid hormone, that T3 or T4, into the cells. Now, that said, T4 is an inactive hormone and has to be activated to T3. So T3 is our most active thyroid hormone in the body. And when we're looking at that, we have to know how much is available and ready to be converted into that active form of T3, and what does that look like in the body. And so when we're doing lab testing for thyroid function, sure, we absolutely want to know what's happening from brain to thyroid communication, but we also want to know who's getting on the bus. Are we getting the communication to know how many people need to be seated on the bus? And then what's happening with that conversion from who gets off the bus and goes into the cells and how everything is activated. And that is highly influenced by your overall health, right? So if you are stressed, if you have digestive issues, because conversion can also happen in the gut and the liver. And so when we're looking at, overall health and thyroid function, it's an important layered multifactorial system.
And because we have kind of the thyroid conversion is going to happen. Well, you've got, how does it activate? So we've got the thyroid stimulating hormone that we always hear about and get tested. And we got the hypothalamus to pituitary gland talking to the thyroid. I think that was on the next one. And what people often get tested is just the TSH.
Yes.
And maybe the T4, but not.
Maybe T4. Yeah, maybe a total T4, depending on the provider. Sometimes a free T4, which is a little bit more than TSH. So yeah. Mm-hmm. But when we're looking at a full thyroid panel, we want to know, because TSH, as much as conventional medicine, like conventional medicine and testing thyroid has not changed in more than 50 years.
Really?
Wow. And we have learned so much about thyroid function and how the thyroid works and how it converts and how it's affected by different stressors. And so TSH is, again, a component of thyroid function, but it can lag behind, or it still may not be giving a really complete picture of what's available in the cells. And so when I do a thyroid panel on my patients, especially as a baseline, we're going to look at your TSH. We're going to look at a total T3, a total T4, a free T3, a free T4, possibly a reverse T3, which I think is also important, and any of the antibodies for thyroid. So we're looking at, is there something going on with Hashimoto's or anything like that that would also be affecting your thyroid health too. And so in looking at all of this, the reason why I would say minimally we want to look at TSH, T4, T3, reverse T3, because we want to know what's happening with the signaling from the brain, the hypothalamus, pituitary, to the thyroid gland, and then how that information is getting disseminated into the body and into the cells. And once we get all of that into the cells, what reverse T3 does is, because free T3 is the most active form of thyroid, in the body we have a lot of checks and balances. We have to have a gas and a brake. So we have to have this push and then stop depending on what's happening, right? So when the body is pushing for free T3, if for whatever reason something happens, the body has to balance out with the reverse T3, which deactivates that free T3. And if we have too much deactivation happening, because, for example, too much cortisol going through the system, that's going to affect how your body is using your thyroid and how we're approaching treatment for your thyroid as well.
Yeah, so a lot of times people don't think about that, looking at your TSH, thyroid stimulating hormone, doesn't give the whole picture of all the different moving parts that need to be in balance and fine-tuned. So it's always frustrating to me that, when you have people on medication for thyroid from their doctor, that you look at what labs, it's like getting your cholesterol tested. Oh, they just did total cholesterol. Well, let's get the breakdown of the LDLs, what type of LDLs. And
what makes up that total cholesterol. It's the same idea. Like we have this, I would say like the above the river, right? And then if we look underwater, it's the iceberg effect, right? So we have this part, but we're missing all of this other important information if we're not testing it. And that's just for, like thyroid, right? And because thyroid works with other systems, you have to take all of those other things into consideration as well. So let's kind of review this before I move to the next one. The thyroid is released. So we get signals from the brain, the hypothalamus, and that's going to send a message to the pituitary gland to release TSH. Then just kind of summarize what happens next again for people, then we'll move on. Yeah. So once the pituitary signals TSH, so the thyroid stimulating hormone in the brain, that's where you get the signal. So the pituitary signals to the thyroid gland. So that's direct communication from your brain to your thyroid of, okay, thyroid, my body is telling us we need more thyroid hormone or less thyroid hormone. So it's an inverse marker, which is why TSH can sometimes be a little bit confusing, because if your body's saying, hey, I need more thyroid hormone, it's going to keep signaling to the brain, like, hey, give me some more thyroid hormone. So your TSH will increase because you're getting this demand. And then that has to knock on the thyroid gland and say, like, hey, we need more thyroid hormone. And so when the thyroid gets whichever message it is, that's when the thyroid will be like, all right, let's take some T3, let's take some T4, send it out into the system. Let's get this thyroid hormone into those cells. And then when we look at your free T3, your free T4, we can see what's available for the cells to use, because those cells need that thyroid to help, upregulate that activity or downregulate that activity depending on what's happening. And T4 ends up being that backup, right? So if we look here, T4 is that inactive hormone. It is the most abundant in circulation because our body wants to have availability of thyroid, right? But we have to convert it into T3, so into that free T3. That T3 or the free T3 is 8 times more potent than T4. So it is like, that's your show. That's your main show, is your free T3. And that's why we have to have a good regulation of what is active and if it needs to be deactivated by that reverse T3. And a lot of this conversion happens in the gut. So we have to make sure that we also have good gut health in supporting thyroid conversion and thyroid function.
So it's not just in the liver. It's in...
I would say the primary place is in the liver.
Okay.
Yeah.
So not in the small intestine. Like you say, gut. Does that, gut into the small
I would say the highest percentage is going to be in the liver. Mm-hmm. And we do also have, like, when we're looking, if you are... I just lost what I was going to say. Sorry. But it'll probably come back if you ask.
Well, so I think this is just such important, the definitions of T4, T3. So TSH releases a signal from the pituitary gland or the TSH and then it releases the T4 is in active form and T3. So depending on if you need less.
Yes.
Reverse.
Yes. And this is what I was going to say. If you are having any kind of thyroid treatment with any kind of thyroid medication, conventionally, the majority of doctors are going to put you on a T4 alone. And when we're looking at T4 supplementation, because it's inactive, it is important to measure that. But if we're only testing a TSH, we're only supplementing with a T4, we're missing a lot of what is happening with the thyroid conversion and the negative feedback loop to let the brain know that we're getting enough thyroid hormone. Because what actually happens in this negative feedback loop is your free T3 or that T3 level is the main communicator from the body back to the brain to let the brain know, okay, now we have enough thyroid hormone. Mm-hmm. If we're only supplementing with T4, we have to know that your body is converting that T4 to T3. And if we're not measuring that, we don't know.
Yeah. You don't know what you don't know. If you don't test it, you're just guessing.
Right. And if you're supplementing with something like Armor and you're not testing a T4 or a T3, you're not, yes, you're testing the signal from the brain, but you're not seeing what's happening at that cellular level. So you're also missing that information.
Well, I've worked with a lot of clients that have thyroid issues and they're on medication, but then I do nutritional therapy analysis or a NAC form, it's a bunch of questions, and they still have a lot of the symptoms of low thyroid. It's like, all right, you're taking this medication, but it's not helping.
Right. And so then we have to look into, is it because there's a nutritional deficiency? Is your body able to convert any of these things? Exactly. And if you don't have a nutritional deficiency, what's going on with your gut health? Are you able to convert everything? And if gut health is okay, wonderful. Then what's going on with your adrenal glands? Because sometimes what can happen is if you end up not testing adrenal function and looking at stress and cortisol, you end up kind of hyperdriving your thyroid and burning your thyroid out when you're not evaluating the whole picture. And so that can be problematic as well.
That's why we need to look at everything and not just do one lab test of just a thyroid. That's why, an FDN and what we use is a judge test. And as practitioners, we look at, as a health detective, looking at all these labs. We measure your gut health, liver congestion, food sensitivities, HPA access, gut dysbiosis,
all
like
tied
the JAMA.
together.
You have to do all of it. And that's why you can't just run one thyroid panel, because it doesn't give you the whole picture.
Well, and I think that also gives testament to, it's not a magic pill fix. I mean, for some people, yes, thyroid can be very helpful, and that's fantastic. Like if you have dialed everything else in and it's just thyroid that needs help, fantastic. But that's why it's going to take a little bit more work than just here, take this thyroid medication, everything's going to be okay.
Well, I think you just said a perfect example earlier that if you look at this slide, then we'll move on, but the TSH and the T4, if you're on medication T4, inactive hormone, if you can't convert it to an active form, that's T3, 8 times more potent than T4. Okay, where does conversion happen? In the liver. How much does your liver already do, and how is your liver functioning? Is it functioning optimal level? Probably not. And
right.
I don't know if we talked today at all about detox pathways 1 and 2, but you have to have your liver functioning optimal level. And I think majority of people, don't you find with your patients, have liver congestion?
Yes, or any kind of gut dysbiosis or gut inflammation.
All the above.
Yeah, yes.
And usually not just one, right? I mean, it's all
right
together.
Right. And a lot of times what happens is because symptoms end up kind of piling up on each other, right? So you're probably not going to get that person that comes in just because they have one symptom going on. It's usually this like, okay, well, like for about 5 or 6 years now, things have been happening, things are going on. And so as the body, compensates for whatever is going on, and then it starts to decompensate, it's being able to evaluate the whole thing, like what is happening with all of the different systems. And based on your symptoms, where do we evaluate? Where do we treat? How do we approach that whole treatment plan?
Mm-hmm.
Yeah.
So that kind of a good segue into thyroid functions, and then we can probably tie into signs and symptoms of dysfunction.
Mm-hmm. Yeah. So a lot of people will say, well, like what exactly does the thyroid do? And, true to that is, what does metabolism actually mean?
Yeah.
A lot of people hear metabolism, and I think it's just this kind of vague word that people don't especially understand when we're looking at overall like true hormone function. And so what does make this tiny gland so important is that it does manage metabolism of cellular activity in the body. We have so many cells in our body. We have so many cellular actions that happen day to day, millions, thousands upon millions of so many cells doing amazing things in our body. And we have to manage metabolism, because if our cells are not working, we're not getting energy or ATP to have these cells do what they're supposed to do. And this is making sure that you are making new cells, that you are detoxing, that you are transferring hormones, that you are, doing all of the things that your body does. So break down food, absorb food, be able to use your muscles, be able to breathe, be able to pump your blood through your heart, be able to manage all of the nutrients that you get. So everything that you put into your body has to metabolize out. That includes what your lungs do with the air, what your stomach or your overall gut does with the water that you drink, the food that you eat. That is all about metabolism. Everything that your body takes in, lotions, creams, anything, your body has to figure out how to metabolize or utilize, clean, and get rid of. And so the thyroid gland has a really big job, huge. And so this is where it affects your sex hormone metabolism. So we're looking at, for females, we're looking at menstrual cycle regularity. Males and females, we're looking at making sure that all of your hormones are balanced. We're looking at fertility, or even just sex hormone balance for energy, sleep, mood, brain motivation. That's important. Thyroid is crucial for brain development as a fetus. So when mom is pregnant, she has to have sufficient thyroid function so that you can develop a brain. You know, your body's working hard to make another human. We need to make sure that you have all of the thyroid available for that. It's also important for nervous system function. So this is looking at your nerves, like reflexes, think your reflexes, and how your all of your nervous cells communicate from your brain through your body. You know, your brain has to tell all of your muscles what they're doing. Your brain has to tell all of your organs what they're doing. Thyroid is important for that. It's necessary for bone development. This is looking at normal skeletal growth and development. So this is going to be, you know, important in the younger years, but it's necessary. It's important. And as we get older, we start to lose bone mass. We're still looking at optimal thyroid function to protect your bones. It stabilizes your heart rate. So we're looking at cardiovascular function, making sure that all of your, like the way that your blood pumps or the way that your heart delivers all of those nutrients throughout the body. You know, if you don't have your heart pumping well, you're not getting your nutrients where they need to go. And it stimulates lipolysis. So think fat breakdown and lipid management. When I say lipid management, I'm talking about cholesterol. And this is looking at not just fat breakdown as an athlete, or if you're doing well at physical activity and maintaining that. It's also just your metabolism in general. What you bring in, how does your body break it down? Do you just store it, or do you break it down for energy? And then being able to manage your overall cholesterol. Cholesterol is important. Cholesterol is your backbone to all of your hormones, right? So you have to have cholesterol. You have to have sufficient management of your cholesterol to make hormones. And then with gut health, it does look at gut motility and how your body's able to, again, break down that food, absorb that food, and then get everything through, like get out what you don't need and then absorb and put into the system what you do need. And so this is kind of a nice segue into like when we have symptoms of low thyroid or even, you know, too much thyroid, the more common one is having low thyroid. We're looking at fatigue because your cells are not working at the same rate that they could. You could have changes in, I'd say I see it more simply in females than males because you'll start to see changes in your menstrual cycle. So irregular cycles or just funky cycles. You'll have brain fog. You'll have muscle pain, joint pain. You can start to see like heart flip-flops or heart palpitations where your heart races. You can see mismanagement of how your body, like this is where you start to have some weight gain or changes in cholesterol levels. And then constipation is a big one, like when we look at gut health, but also like dry skin, dry hair, dry eyes, all of those things. And I know the hard thing about low thyroid function is that it can mimic a lot of symptoms of other things, but because thyroid is so influential in all components of the body, that's not surprising.
So a question is kind of tying this with mitochondria function.
Yeah.
Because it manages metabolism, cellular activity, and just all this stuff seems to be correlated with mitochondria function.
Mm-hmm. Yeah. And so the mitochondria is, it's your little factory house inside the cell. If you can't get all of your nutrients into the cell, your mitochondria has no gas to work with, right? It doesn't have what it needs to do all of that detoxification and get your cells making new things or destroying bad things or any of that. So if you can't feed your mitochondria because your metabolism has slowed down, that also creates issues with detoxification and your body's ability to work appropriately, have good energy, feel like your body is detoxing.
A lot of times people struggle to lose fat weight. And so a lot of times people say, you know, you can't lose weight. And I was just making the noise over here, looking at nutritional therapy checklist. We have all these symptoms, signs and symptoms of low thyroid or high thyroid, but difficulty gaining weight, difficulty losing weight, you know, mental sluggishness, easily fatigued, you know, and excessive hair loss is always one, seasonal sadness, nervous, trembling, flush easily, fast pulse. But the big thing you always think about low thyroid when you can't lose weight. And so it's not just taking a Band-Aid and putting thyroid medication on it, but looking at the why. And what do you find with people that struggle with fat loss? Is it just the low thyroid that's slow because that's your thermostat?
I think, there are definitely a good handful of people that thyroid is like the magic. But a lot of times it has to do with that combination of thyroid and stress response. And that's why in looking at thyroid function, we also want to look at overall hypothalamic pituitary adrenal function too, because a lot of times it has to do with that stress. And it's hard to know, is that stressor just from like, you're working too much, or is that stressor from inflammation because you're not eating well and you're mismanaging blood sugar? So I do find that a big part of weight struggles, whether it's inability to gain weight or inability to lose weight, is not just thyroid related, though it's a big part. It's also related to that stress factor of those, that environmental stressor that influences thyroid function as well.
So I'll just tie that question in because I'm sure people would ask this. And how does stress cause us to gain weight? And how does it slow our metabolism?
Yeah. So I do have, if we keep going through the slides, I have a little breakdown here because we want to also understand what happens in our stress response. So when we're responding to a stress, our body has this thousands-year-old mechanism. So it has this, this hasn't changed really, right? Like how our body runs from a saber-toothed tiger or a Tyrannosaurus Rex or whatever it is. When the body responds to stress, it's going to be the same thing. An immediate stressor, the body needs to be able to run from that saber-toothed tiger or protect itself from that saber-toothed tiger. And so what happens is, the hormones that are involved in this stress response, the main hormones are going to be cortisol. And I feel like cortisol gets a really bad rap because a lot of people think cortisol itself is bad, and that's not true. Cortisol helps keep you safe. But if we are not helping to manage our stress, then cortisol becomes difficult to deal with, right? Then we have to have a discussion of why is our cortisol freaking out. Involved in that is epinephrine, norepinephrine, and DHEA. So when you have this immediate stressor, wherever it comes from, whatever it is, this affects all of your systems. So it's not like cortisol is like, oh, well, just this one thing happens when you are stressed. All of these systems, it's a multi-system response. In your nervous system, you have heightened senses. You become super focused. You become super aware. Your cardiovascular system, you have an increased heart rate. Why? So your body is ready. It's ready to run. Right? So you have vasodilation so that your body is ready to do whatever it needs to do. Send blood to those muscles so it can do whatever it needs to do. Your digestive system gets shut down because why? Digestive system is more active in that calm and that rest and digest. So when you are running from a saber-toothed tiger, your body does not need to put effort into digestion. Vascular or blood vessels, this is similar to cardiovascular. You have that vasoconstriction so that your blood vessels can get that blood where they need to go. You have activation of your muscles. So your musculoskeletal system is ready to do what it needs to do. Your reproductive system shuts down because why? You're not worried about reproducing if you have to run from a saber-toothed tiger, right? Your body prioritizes that. In the endocrine system, your blood sugar is affected. So your body ends up releasing a lot of glucose because your body thinks, okay, we're going to have energy ready, right? We're going to have all of our energy ready to put into the cells so we can run. We can distribute all of this sugar into the cells. And so you have all this glucose flooding your system. Your immune system ends up being blunted because your body needs all of that energy to focus on running away from that saber-toothed tiger. And your respiratory system changes. So the way that your body intakes oxygen allows for your body to be in that stress response, run from that saber-toothed tiger. So you see this huge change that happens in that acute stress response. And I think the next slide.
Just one thing to add on there, because we've talked a lot about immune system the last few months, but a blunted immune response to deal with stress, is that specifically which parts of the immune system would you explain to people? Is it the secretory IgA that's decreased when immune stress is on?
So when it's acute, there are going to be certain cytokines. So these inflammatory cytokines that react. Now, in an acute response is going to be very different than a chronic stress response. So when we look at chronic is when we start to shift into having a poor IgA response and even IgM, just because your immune system has now been shut down for so long, it has a hard time being able to appropriately signal your immune cells to do what they need to do to fight what it needs to fight. And in the autoimmune category, right, that may make people feel better because they're not having immune activation. But when it happens long enough, you can actually start to have more autoimmune complications because then your body is getting these inflammatory signals and not regulating them as well because of that cytokine release.
So acute stress response would be more the cytokine release, and then nonstop ongoing chronic stressors, external and internal, accumulate, and that will give us more of the different immune, as we said, that's secretory IgA.
Yeah.
Inflammation as well.
Yeah. And so this is where, your body doesn't want to have to deal with a common cold if there's an acute stressor, right? Like it's going to send out the signal, like we can deal with this. But this is also why when people are super stressed and they take vacation and then they get sick, because now all of a sudden the body's like, oh, okay, the stress is down. Now the immune system is like, all right, everybody back on. So everybody like gets back on and the immune system does its job. But that's why that can happen. And
if there's this different video interview, but high cortisol, we call it, hyperadrenic versus hypoadrenic. When our cortisol levels are low, those symptoms might change as well.
Absolutely. Okay. Absolutely. And I think it also depends on, how much of this is an acute stressor versus chronic, right? So when we look at cortisol and the stress response, like I said, this is a 1,000-year-old, million-year-old program in our body. Way back in the day, our bodies would be stressed by running from predators. Famine was a big thing. Dehydration was a big thing. And so our bodies have, at least at that time, have developed to be able to compensate with all of those reactions that were just listed in that previous slide, right? So we have to adjust our metabolism to be able to deal with all of that. Modern day stressors, which are going to be, can be acute as well, are immune triggers. Work demand is a big one, right? Dehydration, loss of sleep. So if our body's not getting sleep to repair itself, that is also a stressor. Deadlines can be a stressor for people. Dietary compromise, which I also find ends up, kind of working into work demand, because a lot of times people end up working and they're like, oh, well, I just work so much. I end up not eating lunch. And it's like, okay, but your body still needs to eat lunch, like your body still needs to do all of that. And then environmental and chemical exposures, which we do have a lot of. And I think it becomes more challenging, at least in our modern day stressors, because people are not just going to quit their job and then let their body heal, right? So we have to have a very responsible awareness of what that work demand does to the body, or what those stressors do to the body, to be able to create and open up discussion of how do we manipulate or support the body so that you're not in that stress response and you start to have compromise in all of your systems, because it's not just one thing that changes, right? It's a multi-system effect that happens.
Exactly. So you mentioned the dietary compromise, and I think that's, again, a whole hour episode too, but
right, yeah.
on fasting, because there is acute stressors that are good for us, hormesis, and then there's the chronic stress that's not good for us. And the topic we've dove into a lot on this show is talking about intermittent fasting, and then people doing 24-hour to 3-day fast, 72 hours. And when you're stressed already, I know Dr. Walls was saying it's not ideal to do a longer fast, but how a fast can be a good stress response and get beneficial for cell autophagy, but also some days, if you're already stressed, that can be additional stress already on your full bucket.
Absolutely. And these are the people that say, oh, like I read online that intermittent fasting can be helpful, so I decided to do this, or I decided to do a fasting program, and then they feel horrible. they have a really poor recovery, and it's because they don't have the resilience for their body to be able to manage that. And so as much as there's great research about, intermittent fasting, and dietary manipulation to help manage insulin, to help manage blood sugar control. But if your body is already compromised, it's going to add more stress to it. And so those are the people that feel horrible fasting. Those are the people that can't recover from fasting, where they're like, gosh, it took me like 3 or 5 days after I did, a day fast or even a 3-day fast. And it's because their body does not have the resilience. They don't have the foundation to be able to respond appropriately to that.
That'd be a really good episode to do, because fasting in low thyroid too is also questionable, and for women, and because so many people are interested in intermittent fasting. So those are some good tips to give people to, pay attention to how you feel. And when you're doing intermittent fasting or changing what you're eating differently, how do you feel? Do you feel energized? Do you feel better? I think it's learning how to pay attention that N=1, because it's not one size fits all approach.
Very true.
Stressors. Some people are more stressed out than others.
Very true. And you might be able to do an intermittent fasting of, say that you can eat from, 11 a.m. to 4 p.m. and that's your window. And you might feel great with that. Mm-hmm. Fantastic. But that doesn't mean that, Susie Joe is going to feel the same way. She may have to have a very different and even titrated plan to be able to, as we're working on getting her to a specific intermittent fast schedule, we're also working on other things, right? We're evaluating thyroid, we're evaluating cortisol, we're evaluating her stress response, we're evaluating her day-to-day activity in response to stress.
Good information. All right. So we've got 2 other shows we need to record this year.
Yeah, right. Yes. This slide was just, I just wanted to show here, because we have, in our stress response, we have a fast response and then we have a slower response. And cortisol is actually the slower response. So my example for this is you're driving along, you're paying attention, but somebody comes in and they almost sideswipe you, and you have that your eyes get super big, your focus is right on that car, you start sweating, you are like super aware of everything that is going on. That initial response is going to be that epinephrine, norepinephrine. Mm-hmm. And then once you realize that you're safe and things are okay, you're still driving, you pull over into another lane. About 10 minutes later, you start shaking, right? Then your body's like, okay, what just happened? That's cortisol. And so you have this initial stress response, and then you have cortisol that comes in to take over. So there is, this like faster, slower response that happens with your stress, which makes more sense when we look at what's happening with cortisol. If you keep having all of these epi, norepi triggers, right? And then cortisol is still trying to, balance this throughout the day, throughout the week, throughout the month, throughout the year. Cortisol is going to start being affected more permanently with that kind of stress response. And these are all of the things that happen, right? When you have those stress responses that we already talked about, right? So we bind to fat, the cortisol will bind to receptors in the fat cells in the liver pancreas to release sugar and glucose, reduces signals for reproduction, digestion, growth, immune response. And it actually reduces inflammation. Cortisol can be anti-inflammatory for a short period of time, right? So if you do end up getting in an accident, it allows you to be able to figure out what to do in that time. And these are the people that are like, oh yeah, I was in a car accident. I don't really remember, because your body's super focused on that moment in time. They don't have any pain. Those are, the medics that are like, are you okay? Can you move your head? Can you do anything? And then these are the people that 30 minutes later fall down and are like, I don't know what happened. And it's because their cortisol has now calmed down. And so, but if you keep having that consistent, trigger, your cortisol is always going to be there.
That makes sense. I've had a bike accident a couple times in my life. And I remember my last one, which was 5 years ago, but the next day you wake up, you're like, oh my God, I can't move. And you're in so much pain. Yeah. It's more the delayed response.
Yes. And that's why, because that cortisol, that adrenaline rush, right, helps your body mitigate those pain receptors so that you can continue running from that saber-toothed tiger. That's the whole point. That's that protective part of cortisol. Mm-hmm. But if we manipulate it too much, or if we take advantage of it for purposely or not, then cortisol ends up not working for you and against you.
Mm-hmm. So you're constantly stressed, you're increasing that adrenaline, but the cortisol keeps increasing, and that's over time. You keep having the cortisol activated. I always think of it as a leaky faucet, and the faucet doesn't stop dripping.
Yep, exactly. And so you continue to have binding to, the pancreas and sending out glucose into the bloodstream. And if your body needs it or not, depending on what's happening, you start to have this storage of glucose into fat. You're affecting your reproductive health. You're affecting your digestion, just because cortisol directly blocks your stomach acid. And so then you're not able to break things down. You're not able to absorb things. So then there's a dietary or nutritional component that happens there.
So funny, because when you do nutritional therapy with people and test with FDN lab testing, so many people don't realize that they need supplement when they're eating and have digestive enzymes and HCl, betaine, and have stomach acid. And no one really ever talks about that. And they think, oh, I don't need to have it,
Right. Like I should let my body do what it needs to do, except it's already been told not to do it. So, and there's once your body creates this routine, our bodies love routine, right? So if we give them a routine of constant stress, they're going to roll with it. And it takes a long time to reverse that. You have this inertia of poor stress management or poor, cortisol management. And we have to not only stop that, but then retrain the body. And so I have, a lot of people are super frustrated because they're like, I wanted to, be healthy a year ago. Yeah. Well, yeah, that would be really great, but there isn't a magic pill for that. And your body has to change. There has to be effort put into that change, just like there was effort put into your poor health, whether intentional or not. And so there's also, that discussion has to happen with people too.
So we'll move on, but this is what I wrote about in my book, Life is Not a Race, what happened to me starting back in 2013, which, as I said, built up probably 5-10 years before that and just happened to, show up with, you couldn't ignore it. I had gained 30 pounds in I felt like a month. It was overnight. Yeah. You wake up, you're like, okay, all my muscles just disappeared and all this fat just came on my body. Right. So that's binding receptors, fat cells. And then I could never get pregnant. Digestion issues. I had all these weird food sensitivities suddenly. Yeah. I was totally fatigued, had no muscle strength and power. And I just had this, 3 months later after having the best triathlon run cycling season of my life. And then just boom, it just disappeared. Yeah. So that's why I love talking to you guys at Dutch and sharing this information with athletes, because my mission, and I feel like my purpose, I've been given this opportunity to share this information as we're sharing the slides, why it's important to stop this before it happened. And you're still, because it's a domino effect, as we're talking about all this stuff, which started thyroid, but now we're talking cortisol and stress, but it's all connected.
It is, because because this is where we have, this is kind of also a segue into cortisol affects your insulin. And because of that, when we have these stress responses, it compromises your insulin response. And so when we look at this, when your cortisol levels increase, the sensitivity of our cells to insulin decreases. So insulin is like your, he's like your gatekeeper, as where whenever you get any kind of sugar in the bloodstream, insulin lets your cells know, like, hey guys, there's sugar coming, there's energy coming. Open your door so we can put this energy in here. But if you are not sensitive to that anymore, that sugar stays in your bloodstream. And that's what sugar does to your blood vessels, is it causes inflammation. It causes destruction of your blood cells. And so it can happen short term, right? So that your body gets that sugar in, your insulin's able to get some of that sugar into the cells. But then if it doesn't stop, you have this insulin dysregulation, you have this glucose dysregulation, you have more storage of glucose, you have more destruction of your blood vessels. And so that's where we have this cortisol insulin relationship that is supposed to be helpful at first, but then it ends up being more detrimental to you the longer your cortisol keeps kind of beating down insulin.
Yeah, good image for people to look at. And I think one of the images I always think of when you think of sticky cells is in just what sugar does to our cells and our arteries is that jam jar, like and how it gets sticky and you get dried on the outside, and what happens to it, you can't open it and everything sticks.
Yeah. And that happens in your blood vessels. Like, what? That's horrible. Like your poor little blood vessels are trying to give you all of your nutrients, but they can't now. And so this was where, like with the adrenal glands and thyroid and how they affect each other. So this is looking at elevations in cortisol end up suppressing thyroid function, because even though the thyroid is in charge of metabolism, when you're running from a saber-tooth tiger, thyroid's like, all right, you go. Like cortisol, take the lead. And so when that happens, thyroid's like, all right, well, just let us know when we're back on. And if cortisol ends up being longer term, you're not going to get that signal back, right? So you start to see this response that happens overall in a longer term, or creating a chronic stress response, that thyroid starts to get compromised. So that's why it's important to look at that stress response and how it's affecting thyroid, and testing thyroid, but also looking at cortisol.
Well, I think it's a good way to put it all together and look at the big picture that, people with thyroid issues, symptoms, they need to look at the why. And, liver function, I guess just going back to the very beginning of our conversation about converting T4 to T3 into the active form. And gut health. How many people have leaky gut, poor mucosal barrier, and have dysbiosis? I mean, it just all ties together that we need to look at the whole picture and do all the labs. But I know we're running out of time. So the next slide is a great one to go over too.
Yeah, I just wanted to put on here because I know that there's definitely a change in how people are using these words. So I think a lot of people are starting to use HPA imbalance versus adrenal fatigue, because when we look at adrenal fatigue, it's not like your actual adrenal glands just stop working, right? But for lack of a better term, previously it was about adrenal fatigue. Like it's really what I call that gray area of adrenal function. You do have pathologic pictures of Addison's disease where your body really isn't getting enough cortisol. And that is a true disease presentation. But adrenal fatigue has now been more commonly referred to as HPA imbalance, so that hypothalamic pituitary adrenal imbalance. And this is where it suggests compromised response to stress, whether it is because there's too much cortisol going on, or it's been happening long enough that there's not enough cortisol being produced, not to the point of Addison's or, like a disease state, but it's that gray area of like, okay, we can test your levels in the blood and an endocrinologist is going to say, you're fine, but you don't feel fine.
Yeah.
And so in that gray area, this is where we look at HPA imbalance. Like there's definitely compromise of what's happening with how your cortisol is managing your energy and your stress response throughout the day. So it can affect not only how much cortisol is made, but how your body uses cortisol throughout the day. We expect, hopefully, that cortisol is doing its job. It starts to, like right before you wake up, it starts to climb so it can get you ready for your day, right? So cortisol is supposed to give you that big oomph so that you can get ready and go about your day. And then it starts to calm down so that you can have melatonin come out at night. But when you are having these stress responses, you start to see changes in like, oh, well, like I'm just like too amped up to sleep at night. So then you start to see this compromise in sleep, or you're too tired to wake up in the morning, and it's starting to affect that cortisol pattern throughout the day.
All right. Carbohydrate metabolism. Let's see. That's a big topic for people too.
It is a big topic.
Perfect.
Yes.
3 minutes.
So, right. So this was, I did put this in here just because when we look at thyroid function, the thyroid in general, so thyroid hormone helps to manage insulin sensitivity. So when your thyroid is off, it influences insulin sensitivity. And when we look at thyroid hormone in general, it also influences carbohydrate metabolism. Now, does that mean it doesn't influence fat and protein metabolism? No, but it is very important with carbohydrate metabolism. There has been research that low carb diets reduce thyroid hormone levels in the body, specifically T3 levels, which is really interesting. So when we do testing for thyroid function and we're looking at what's happening with your T3, T4 levels, for those patients that are doing low carb or even keto type diets, it would not be surprising to see low levels of T3 specifically, right? That's that really strong activator of thyroid. But what they did find in these studies was that the thyroid receptors became more sensitive in low carbohydrate environments, meaning you don't need as much thyroid hormone, banging on the cell saying like, hey, let me in, because you don't need as much thyroid stimulation to get the thyroid response in the body.
To look that up. That's from Virta Health, which is Dr. Finney's and Volek and Finney's website.
Yeah. So it was interesting because I think a lot of people will say, well, if you do low carbohydrate, make sure, and he talks a little bit about this in his study where he was like, a lot of people will say, take a break from low carb. But I agree with his study where like once you become fat adaptive or low carb adaptive, why offset the balance of that by all of a sudden loading your body with a bunch of carbs, unless you're specifically carbohydrate loading for, some other reason, but you can still maintain a healthy balance of insulin and thyroid function in a low carb environment, at least at this point, right? Like the studies don't show true detriment to that. And I will say, there are caveats to either whether you are low carb versus keto low carb, like low carb, high fat, or just low carb in general. It's always going to be an individual evaluation, right? We want to know, how do you feel? How is your body responding? What's happening with your kidney function? So you have to work with your providers in that. But in these studies, it showed, okay, yeah, we see a drop in T3, but the sensitivity of thyroid hormone and the signaling needed for thyroid effect on insulin and on metabolism is not as high demand, which is really cool. So the body doesn't have to work as hard to manage your carbohydrates.
Makes sense.
That's pretty cool, right? So yeah.
I think a lot of people that are athletes and then female athletes are always curious probably about hormones and carbohydrates because we talk about, obviously it's called the Low Carb Athlete podcast, but we're eating low carb because we want to be fat adapted athletes. I just did tons of research last week for a seminar I gave for KetoCon that our guidelines are going to be a little bit different because we don't have chronic illnesses like they'll work with here in having the 50 grams of carbs a day, that we can still be fat adapted and burning fat for our main fuel and staying healthy and managing our blood sugar levels and showing some ketones at low levels with even doing 50 to 150 grams a day for carbohydrates, but of good quality food. But I think what I found in research that it obviously depends on the person and their activity level and maybe their carb sensitivity. And part of that's genetics too, as well as multiple other areas.
Yes. And that said, we're looking at low carb and even like low carb, high fat. The body has to, it's not like you can just switch to that in one day. Your body has to adapt to that, right? So I think that there's also maybe some misunderstanding or misrepresentation of that your body still needs to slowly go into those changes so that we know how your body's going to respond. And because there are certain genetic presentations that don't do well with low carb. And so it's being able to understand that too. So I think that's a lot.
In FDN, we do metabolic typing, and Paul Chek in the Chek Institute with Holistic Lifestyle Coach, he uses metabolic typing, and nutritional therapy is about blood sugar regulation. So, I always like to look at metabolic typing if you're fast or slow, oxidizer or mix, but also look at my genetics if I'm more carb sensitive than others. And using something like Keto Mojo to measure blood sugar, so how much you can have and good quality carbohydrates. I have a couple of clients that are going to college or college age kids and working on their nutrition that think, I can't have bread ever again. I can't have chips. Like, well, ideally it's not. Giving your body energy and good sources of carbohydrates are always confusing to people, but that you don't need to have bread, but if you need bread, what are some alternatives? But it's funny how.
Absolutely. Yeah. Well, and I think there's a lot of education that comes with that too, right? In doing any of those dietary changes, there are actually really wonderful options. And I think that because we're so used to our standard American diet, we get into this, only these things are available, but really we have so many options available for nutrient dense, nutrient rich foods that can still support your body metabolically.
Yeah, I know. Well, there's so much to dive into and talk to you. And I know we went a little bit over time, but everyone can reach out, Dr. Rice at the Dutch test, and you can find more information about the Dutch tests on my website, debbiepotts.net. And if you're interested in learning more about the lab testing and what we do, correlating all this information, let us know. And we probably have another bunch of questions to go into another podcast.
Yeah.
So
I know we can just keep this like rolling and rolling.
I know, but I think hormones and fasting would be a great topic, and for females and female athletes as well, because I think that's a big thing. People want cell autophagy, mitochondrial health, but keep your hormones in balance. So thank you.
Yes. Yeah, absolutely. Well, thank you so much for making the time. I appreciate it.
Good. Well, have a great day, and thanks for everything you are doing for us and sharing that information. The slides, everyone should hopefully watch this and just to learn more about thyroid, because I know we all struggle with hormone balance, and I think it's pretty common for most of us to have something out of whack, and it's multiple reasons why. That's your normal, but you can do something about it and optimize your hormones by working with a practitioner that's skilled in that to help, because it is nutrition and lifestyle habits as well as the right supplements to boost everything back to optimal level.
Yes, very true. Well, thank you for all that you do. Thank you so much.
Thanks for listening to the Low Carb Athlete Podcast. If you have any questions, feedback, or topic suggestions, let us know on Facebook or at debbiepotts.net. You can help us to continue to grow by leaving a review on iTunes. Thanks again, and we'll see you next time.